Studies show that almost 30% of all adults and 50% of all older adults, particularly those with chronic conditions, have a deficiency of this important vitamin. This deficiency isn't just common, it plays a significant role in the hardening of arteries and the calcification of the circulatory system and other tissues, all of which are closely tied to the aging process that you'd want to avoid. I am talking about vitamin K2 deficiency. First of all, let's see what causes vitamin K2 deficiency. Since the primary natural sources of vitamin K2 are animal-based or fermented plant products, people following strict vegetarian or vegan diets are usually at a higher chance of deficiency. Also, vitamin K2 is a fat-soluble vitamin, which means that any condition that affects your body's ability to digest and process fats is very likely to interfere with vitamin K2 absorption too. Some conditions that affect the absorption of fat-soluble vitamins, including vitamin K2, are Crohn's disease, celiac disease, and cystic fibrosis. Similarly, certain medications, particularly long-term use of antibiotics or drugs that interfere with fat absorption, can increase the risk of vitamin K2 deficiency. The liver also plays an important role in fat metabolism, the synthesis of clotting factors, and the activation of vitamin K2. This means that people who have liver problems may develop vitamin K2 deficiency sooner or later. Another very common reason is aging. Because as people age, their ability to absorb nutrients decreases naturally. Studies showed that a significant percentage of older adults may have lower vitamin K2 levels. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. But why is vitamin K2 so important? And what can happen if you don't take enough of this vitamin? Vitamin K2 is essential for several physiological processes in the body. It helps to activate certain proteins that play a key role in calcium metabolism. Two of the most significant of these proteins are osteocalcin and matrix GLA protein or MGP. When activated by vitamin K2, osteocalcin helps bind calcium to the mineral matrix of bones and teeth. This helps you have a strong, healthy skeletal structure. Without enough vitamin K2 or osteocalcin, calcium is very likely to build up in your arteries, causing hypercalcemia. This condition usually shows up in symptoms like fatigue, frequent thirst and urination, nausea, vomiting, bone pain, muscle weakness, feelings of confusion or difficulty focusing, irregular heartbeats, and high blood pressure. Many people, especially women and older adults, take calcium supplements, without even realizing that taking calcium without enough vitamin K2 can actually be dangerous. Vitamin K2 acts like a signal to your body and tells it to move the calcium to your bones and teeth rather than stay in the arteries and cause hypercalcemia. This hypercalcemic effect can also show up in aging signs on your skin, as too much calcium in the arteries can reduce the blood flow to your organs, including your skin. This can affect the availability of nutrients and oxygen for your skin, reducing your skin's ability to heal and look alive and making it look dry and wrinkled. Another protein is MGP, which acts as a calcium regulator, preventing the unnecessary buildup of calcium in soft tissues like cartilage, tendons and ligaments, kidneys, and even in the brain and heart valves. This buildup of calcium is known as calcification. Its symptoms include pain and stiffness in joints, limited movement of affected joints, and in worse cases, kidney stones, chest pain, and even heart attacks. So without vitamin K2, there won't be enough MGP to stop calcification. And when you have enough vitamin K2 in your body, and so these two proteins, it'll trigger the storage of calcium in your bones and teeth, where it's supposed to be. In fact, many studies have shown that adequate vitamin K2 intake is associated with a reduced risk of fractures, particularly in older adults. Another important thing is that vitamin K2 also contributes to the clotting factor of the blood. In the liver, vitamin K2 is used as a cofactor for an enzyme called gamma-glutamyl carboxylase. This enzyme is responsible for starting a combination of processes that end up in the formation of blood clotting factors. Without sufficient vitamin K2, your blood may lack blood clotting factor, leading to a higher risk of bleeding. So I hope now you know how bad can vitamin K2 deficiency be. If you have enough of this vitamin with your diet or supplements, you'll start noticing healthy blood pressure, overall better heart health, more activeness and better movement of your muscles and joints, and of course, strong bones. But before you start taking vitamin K2 supplements, it's important to figure out how much of it your body has. There is a common blood test for vitamin K2, but it's a bit tricky. You see, vitamin K2 is basically a type of vitamin that dissolves in fats, not in the watery part of your blood. So when we go for blood tests for vitamin K2, they don't always show how much you really have in your body. It might be a good idea to get a blood test, but even if you do, it can be tough to understand the results. So it's best to ask your healthcare expert if you really lack this vitamin, and whether you should take vitamin K2 supplements or just fulfill your K2 deficiency from diet alone. Now, the question arises, how much vitamin K2 should you consider taking? In the United States, the recommended amount of vitamin K2 that you should have each day is about 100 micrograms, 90 micrograms for women, and up to 120 micrograms for men. But you may be surprised to know that the amounts of vitamin K2 used in studies that tell us about its effects to reverse unhealthy aging used roughly 500 micrograms a day. That's 5 times the recommended daily amount in the US. The point is, if you're getting it from supplements as recommended by your doctor, that's perfectly fine. Most supplements range from 100 micrograms a day up to 1,000 micrograms a day. And don't forget to ask your doctor about taking vitamin D3 supplements with vitamin K2 as well. Many experts advise taking 1,000 international units of vitamin D3 with 100 micrograms of vitamin K2 for most adults. Eventually, your doctor knows best about your individual needs, so it's best to consult them. Thank you for watching and subscribing to the channel. See you in the next video.